So, hello everyone. So my name is Maja or Malvina, whatever's easier, Carrion, and I am I'm the assistant director for ProMED, which hopefully many of you are familiar with, which is a program of the International Society for Infectious Diseases. I'm also a DRPH student at the Boston University School of Public Health, and so this is sort of my dissertation work that I'll be talking about today. And I was saying to a few people, it's so nice not to have to spend half of my slides actually explaining what Chagas is for once. So hopefully this will be interesting. So I know Dr. Hotez had already sort of included a variation of this slide, but I always find it just kind of mind-boggling. And I think his slide was a little more updated maybe to even show potential vectors going further north, but just the overlap I think is between these two maps is just really striking. So Massachusetts is, I don't think you can see the cursor, but Massachusetts, for those of you who don't know, is up in the northeast side, so currently still in the white, but we'll see. So within Massachusetts, so my work is focused domestically. I previously worked in Peru, and that's how I got interested in Chagas disease. And then when I was in London for a little while, and then when I came back to Massachusetts, I really got interested in the domestic problem and the lack of awareness. I'm not from the clinical side, I'm from the public health side, so the whole awareness piece, the whole sort of access piece is really interesting to me. So in Massachusetts, the thing that really is a big, kind of focus, I guess, because again, not apparent that there's direct vectorial transmission, is kind of congenital transmission. I'd say if we had to focus on one thing, that would be most of interest. But as we all know, there's very little data about even prevalence or kind of what's going on. So why is Massachusetts interesting? So this is probably even up there, not that big, but this is just taken from census data, looking at the different types of Latinos within Massachusetts, and it's a synthetic estimation looking at potential cases of Chagas disease. Now, this is based on the 2005 country prevalence data from WHO, and the reason. So an estimated about 5,000 cases within Massachusetts out of a population of a little over or 680,000 Latinos. So I stick by the 2005 or 2006 estimates because Massachusetts has a pretty established Latino population, and I'm not convinced that the new I prefer the old estimates. I think they more probably accurately reflect even with all the issues, but more accurately reflect what's going on in Massachusetts. So there's another sort of interesting bit about why Massachusetts is important. So if you look at this graph, it will show you, this table, it will show you sort of how the U.S. and Massachusetts compare. So there's some important things within Massachusetts, which is we have a significant Salvadoran, Guatemalan, and Mexican population. So higher in some cases than the percentage for comparatively for Massachusetts. So 7% of Massachusetts' Latino population, for example, is Salvadorian, 6% Guatemalan. So again. And why else is it important to look at Massachusetts, or why I think that Massachusetts is important for understanding prevalence? So Dr. Mimani mentioned that Massachusetts isn't one of the top 4 countries for Latino immigrants, but we have this pretty big immigration change. So from the population change from 2005, and again, this is all census data, so this isn't accounting for any undocumented or all the people who are not covered by the census. So again, you can imagine that this is quite a underestimate, but a 60% change in the Guatemalan population from 2005 to 2014 is quite striking, and similar with El Salvador, and I think given the political situation there, at least. I think that's not, I wouldn't expect that a lot of these numbers are going to go down anytime soon. So we're also looking at how the population is changing over time. And then, so these are just a few maps just showing sort of what the distribution is within Massachusetts. So you can see on your left that Massachusetts actually has a pretty significant Latino, Hispanic, or Latino population anywhere within the state. But if you look at Essex County up at the top, the northern part of the state, there's pretty much that entire county has at least 24% Latino population within those towns and cities. And then if you look at the right side, you can see that within Suffolk, which is Boston, basically, so the larger one on the right-hand side, there are parts where 40% of the population is Hispanic or Latino. So I'm not going to talk too much about this because other people have talked about it, but there's this definite lack of physician knowledge, right? So that's a pretty big barrier. And then there's the lack of patient knowledge. So again, just like Dr. Mehmadi just described, even within the communities themselves, people aren't aware of what's going on. There's no mandatory reporting in Massachusetts. There was for a few years, but they decided to remove it. So it's actually possible in Massachusetts to have a patient and get treatment from the CDC and never tell the state that you're treating a patient for Chagas disease, which seems like a pretty significant barrier or concern. I talked about this increasing immigration and also migration, and we've talked about the political climate a little bit today and how things are changing in the U.S., and we don't really know what's going to happen with that. And then comorbidities, I think, as populations get older and as we have a lot of issues within the U.S. in terms of obesity and and a lot of other potential comorbidities that can increase the effects of Chagas disease or just, create further problems. So the advantages of looking at Massachusetts is Massachusetts, as some of you may know, had passed Mass Health, which was universal insurance for everyone many, many years before Obamacare came in. So actually, uncharacteristically, the Latinos in Massachusetts tend to be one of the lowest uninsured groups within Massachusetts itself because there was so much outreach done and so much work done in the communities to try to get them onto Mass Health. So that's, that's an advantage actually to doing this kind of work. We have a lot of sanctuary cities and towns. The population I kind of mentioned, but within Massachusetts is the Latino population, unlike a lot of other places, there's a very small migrant population, so people aren't moving in and out of Massachusetts. The Latino populations tend to be pretty well established and have been there for decades. So that's helpful in terms of having these built-up communities. So basically, the proposal that I'm working on for my dissertation is a two-pronged approach. So going into churches and community centers and creating a systematic approach over 6 months of screening. So doing biweekly awareness and screening within the churches to being able to, and communities as centers. So having an awareness and education component, a screening component, and then having that follow-up, so that continual sort of interaction every 2 weeks with these people. And then we have Boston University as a hospital, which is the Boston Medical Center, which is also a safety net hospital. So similar, we see a lot of people, the people who fall through the cracks are seen there as well. And East Boston Neighborhood Health Center, which is located up in that that area where there's quite a large population. They've started a project recently with Jen Mangoler and a few other colleagues where they've created EPIC prompts, and they've done some training sessions for physicians there. And so we are looking to expand that and to facilitate referral between Boston Medical Center and this health clinic. And that's all.